A day in the life of a UP student here at SM.
Halaga, boots sa interviewon ta.
Excuse me, excuse me. Can we have an interview with you? Ang Calaguing ganyo nga obo.
Baka ito iba siguro nga aman ni Sao.
Ay hala, ba si epignotitis na na.
Ha? Epignotitis ka po na. Iwan na pang balon man.
Epiglottitis is a respiratory infection that is characterized by the swelling of the epiglottis. Epiglottis is the muscle that is responsible for guiding your food onto the esophagus and air into your trachea. It is classified as an upper respiratory infection. If left untreated, it could lead to asphyxiation and then death. It is commonly caused by Haemophilus influenzae, a type B bacteria. It can be transmitted via droplets of saliva or direct contact. It is characterized by a severe sore throat, difficulty and pain when swallowing, difficulty breathing which may improve when leaning forwards, breathing that sounds abnormal and high-pitched or stridor, a high temperature, irritability and restlessness, muffled or hoarse voice, and drooling.
Sobrahan ka man, hindi mo nag-epiglottitis. Malay mo, bacterial bronchitis lang gali.
Bacterial bronchitis? Ano na yan?
Bacterial bronchitis is a respiratory infection that is characterized by the swelling of the trachea. Trachea is also often called the windpipe and is classified as a lower respiratory infection. It is usually caused by the Staphylococcus aureus bacteria. It can be deadly if left untreated. It can be caused by an infection or a post-viral infection complication. It is characterized by high fever, severe throat pain, difficulty breathing, stridor or high-pitched breathing sound, hoarseness, cough, and respiratory distress. Its target age group is children under the age of 6. So how can we treat it? At home, you can use nasal sprays and humidify your room to prevent your windpipe from drying and hurting. For treatment, we suggest you contact your doctors.
Diba si ano na acute
Ha? Di na cute?
acute bacterial sinusitis.
Acute bacterial sinusitis man. Kabudlay pang ang balon na kabulol. Kuya sinyo.
Acute bacterial rhinosinusitis is a respiratory infection that is characterized by an infection in your nasal cavity and sinuses. It is classified as an upper respiratory disease. It is usually caused by Streptococcus pneumoniae bacteria. Its mode of transmission is via direct contact and droplets. Since it is very close to your brain, it is life-threatening if left untreated. It is characterized by purulent anterior nasal discharge, purulent or discolored posterior nasal discharge, nasal congestion or obstruction, facial congestion or fullness, facial pain or pressure, hyposmia or anosmia, and fever. It typically affects children 1 to 18 years old. At home, you can use a hot compress to relieve your sinuses, but it would be best to go to your doctor.
Ate ba si, na siya, miss? Ang streptococcal pharyngitis?
Streptococcal? Ano pag ginaya kabudlay na ganyan balon? Kabudlay pag i-dispel?
Ate, ano yung strep throat?
Naamo na iya. Ano na iya?
Streptococcal pharyngitis, also commonly known as strep throat. It is a respiratory infection in your pharynx that causes it to inflame. It is classified as an upper respiratory infection. It is commonly caused by group A Streptococcus bacteria. It can be transmitted by direct contact and droplets. It is usually characterized by these symptoms: fever, pain when swallowing, sore throat that starts very quickly and may look red and swollen tonsils, white patches or streaks of pus in the tonsils, tiny red spots on the roof of the mouth, swollen lymph nodes in the front of the neck. It typically affects children 5 to 15 years old. This, however, can be treated at home with warm salt, water, and honey. You may also buy over-the-counter medicines such as amoxicillin and penicillin, but of course, doctor is always advised.
Ay halagid. Basi SARS na na.
SARS? Ano na iya?
SARS pala. Severe Acute Respiratory Syndrome.
Ano? Maansin niyo sakit ang ulo ko.
Ala, hadlok man, ginabala.
Tuod ka.
SARS, also known as Severe Acute Respiratory Syndrome. It is a respiratory infection that is related to COVID-19. The disease, SARS, is SARS-CoV-1, while COVID-19 is SARS-CoV-2. It is an upper respiratory disease caused by SARS-CoV-1. It is characterized by the following symptoms: fever, cough, shortness of breath, difficulty in breathing, muscle aches, malaise, chills, rigors, headache, sore throat, and diarrhea. Everyone can be affected by SARS, but mostly adults. There are multiple home remedies such as stay hydrated, get plenty of rest, inhaling steam, using a humidifier, gargling with warm salt water, mix honey and lemon in warm water, some herbal teas, and over-the-counter remedies. However, we advise you to go and consult your doctor.
Maansin niyo gapang istorbo na gani ka mo gapang hadlok pagid ka mo pa-check up na lang ko gani. Thank you gid ha.
Welcome! That is why it's also important to have a healthy body and healthy lifestyle. Para makaplan mo per miya.
Always stay cautious about the virus that surrounds us. Stay safe and stay healthy.
Bye-bye!